Ever wondered what causes disc herniation? Disc herniation occurs when the soft center of a spinal disc protrudes through the exterior casing. Some herniations cause no symptoms, while others can lead to discomfort and pain, disrupting our daily lives. Understanding disc herniation is key, so let's embark on this journey, shall we? Disc herniation may sound complicated, but it's often the result of something simple: aging and everyday wear and tear. To fully grasp the cause of disc herniation, let's take a moment to understand the human spine and its structure. The spine, that beautifully intricate part of our body, is a complex structure made up of 24 movable bones, known as vertebrae. Between these vertebrae are flexible, gel-like pads called spinal discs. These discs act as shock absorbers, preventing the vertebrae from rubbing against each other and enabling us to bend, twist, and flex without discomfort. Now, each of these discs is composed of two parts. The inner part, called the nucleus pulposus, is soft, gel-like, and primarily composed of water. The outer part, known as the annulus fibrosus, is tough and fibrous, forming a protective layer around the nucleus. Together, these two parts provide the perfect balance of strength and flexibility, but as with many things in life, time and usage can take a toll. As we age, our spinal discs begin to undergo changes. One of the primary things that happen is that they lose some of their water content. This loss of hydration makes the discs less flexible and more prone to damage. Think of it like a sponge. When it's wet, it's soft and flexible, but as it dries out, it becomes stiff and brittle. This process, known as disc degeneration, is a normal part of aging. However, it does make our discs more susceptible to injury. A minor strain or twist that would have been harmless in our youth can now lead to a tear or rupture in the disc's outer layer. When this happens, the inner gel-like substance can leak out. This is what we refer to as a disc herniation. To put it simply, disc herniation is when the inner part of the disc protrudes through a tear in the outer part. This can occur anywhere along the spine, but it's most common in the lower back, known as the lumbar region, and the neck, or the cervical region. Now, it's important to note that not all disc herniation is symptomatic. In some cases, individuals may have a herniated disc and not even know it. However, if the protruding disc presses on a nearby nerve, it can cause a variety of symptoms. These can range from mild discomfort to severe pain and can even result in numbness or weakness in the arms or legs. So, what causes this loss of water content in our spinal discs and subsequently disc herniation? Is it just age? Or are there other contributing factors? While aging is indeed a major factor, it's not the only one. Lifestyle choices can also play a significant role in disc health. For instance, smoking has been shown to accelerate disc degeneration. This is because smoking reduces the amount of oxygen and nutrients that reach the discs, causing them to dry out faster. Similarly, poor nutrition and lack of exercise can also contribute to disc degeneration. A diet lacking in essential nutrients can hinder the body's ability to maintain and repair the discs, and a sedentary lifestyle can lead to weaker muscles and less support for the spine. Another factor is body weight. Being overweight or obese can put extra pressure on the spine, particularly the discs in the lower back. Over time, this added strain can accelerate disc degeneration and increase the risk of herniation. In addition to these, certain occupations that involve heavy lifting, bending, or twisting can also increase the risk of disc herniation. The repeated strain and stress on the spine can cause the discs to wear out faster. And let's not forget about genetics. Just like eye color or height, our susceptibility to disc degeneration and herniation can be partly inherited. If your parents or siblings have had disc problems, you may be at a higher risk. So, as you can see, disc herniation is not just a result of aging, but a combination of various factors, including lifestyle choices, occupation, and genetics. It's a reminder that we need to take care of our spine, just like any other part of our body. But don't worry, there's a solution to this discomfort. If you've been feeling the discomfort of disc herniation, chiropractic treatment can be your answer. Chiropractic care has proven to be an effective treatment for many people suffering from the pain and discomfort associated with disc herniation. This treatment method focuses on the musculoskeletal system and particularly the spine. Chiropractors use their hands or a small instrument to apply a controlled, sudden force to a spinal joint. This process is known as spinal manipulation or adjustment, and it can help restore mobility to joints restricted by tissue injury. Let's take a moment to explore the science behind this. When a disc herniates, it can put pressure on the surrounding nerves and cause severe pain. Over time, this can lead to decreased mobility and a significant impact on your quality of life. This is where chiropractic treatment comes in. By realigning the spine and reducing the pressure on the affected disc, a chiropractor can help manage the symptoms of disc herniation and, in many cases, significantly reduce the pain. In addition to spinal adjustments, chiropractic care often includes a variety of other treatments. These may include heat and cold therapy, electric stimulation, and rehabilitative exercises. These treatments are designed to help reduce inflammation, improve circulation, and strengthen the muscles around the affected area, further supporting the healing process. Now, you might be wondering, how does a chiropractor know exactly where to adjust? Well, it all starts with a comprehensive examination. Chiropractors are trained to evaluate your overall health with a special focus on the spine. They will ask about your medical history, perform a physical examination, and may use diagnostic imaging to determine the most effective treatment plan for your specific condition. Once the chiropractor has identified the disc that is causing your discomfort, they will use their hands or a small instrument to apply a controlled, sudden force to the affected joint. This is done in a precise manner to ensure that the adjustment is as effective and comfortable as possible. The goal of this adjustment is to help realign the spine, reduce pressure on the affected disc, and improve nerve function. It's important to note that while chiropractic treatment can be highly effective, it's not a quick fix. Disc herniation is a condition that typically develops over time, and it can take time for the body to heal. That said, many patients report feeling relief after their first few treatments. Over the course of several sessions, the chiropractor will continue to make adjustments as needed, working to reduce pain and improve mobility. In addition to the physical treatments, a chiropractor will also provide guidance on lifestyle changes that can support your recovery. This might include advice on diet, exercise, posture, and stress management. The goal here is to help you take an active role in your own health and well-being, empowering you to make choices that support a pain-free life. It's also worth noting that chiropractic care is a safe and non-invasive treatment option. While any form of treatment comes with potential risks, the risks associated with chiropractic care are generally low. Serious complications are rare, and most patients experience little to no side effects. The most common side effect is some soreness or discomfort in the treatment area, which typically subsides within a day or two. So, if you're suffering from the pain and discomfort of disc herniation, consider giving chiropractic treatment a try. It could be the solution you've been looking for. Remember, you don't have to live with the pain. With the right treatment and a commitment to your own health and well-being, you can take control of your symptoms and start living a more comfortable, pain-free life. Don't let disc herniation control your life. Seek chiropractic treatment today and take a step towards a pain-free life.